and welcome. Well, thank you for joining us today for Clearing the Air, Understanding Wildfire Smoke Impact on Pediatric Asthma in Washington State, presented by the Bree Collaborative. My name is Cora Spina. I use she, her pronouns. I've been a nurse practitioner for 16 years and a registered nurse in total for 24 years. I'm currently working on my doctorate at the University of Washington, and I'm interning at the Bree Collaborative. What I'm most interested in is cross-sector collaboration with a lens focused on equity. In a little bit, we'll hear from Emily about what we do here at the Bree, but I feel really grateful to be part of this space. It's pretty unique to find a space where representatives from across healthcare entities can come together and collaborate on shared goals. Today's going to be a great day. I'm excited to be here. We had more than 70 people register for this webinar across Puget Sound and Eastern Washington. And we even have folks joining us from our neighboring states, including Oregon, Montana, Colorado, and California. And I just want to give a quick shout out to my UW classmates and the Population Health and System Leadership cohort, who I know are joining us today too. Before we start, I just want to give a quick land acknowledgement. I'm zooming to you from Edmonds, Washington, home of the Snohomish people. They hunted, fished, gathered, and took care of these lands before our occupation. Their successors are the Tulalip tribes. And if you'd like to learn more about this community, and I invite you to check out the Highbulb Cultural Center. I'll ask Beth to share the link in the chat. Their website is also a great place to inform yourself about our ancestors. Sorry, one second. I'll just go through some housekeeping real quick. So during this event, if you have questions for our speakers, please put them in the chat. At the conclusion of the presentation, we'll have a Q&A panel discussion. And at that time, I'll ask the speakers questions from the chat box, or you can jot them down. And when the panel discussion starts, I'll invite people to ask questions from the audience as well. During the presentation, please ensure that you're on mute to minimize disruptions to our speakers. And also, just to let you know, this event is being recorded and will be accessible on our website after the event. You'll also receive a PDF copy of the slides that are presented today. Here's our agenda. We'll start by providing a short introduction to the Bree Collaborative. Then we'll spend 40 minutes hearing from our speakers. I'll leave the last 20 minutes for a panel discussion, and then we'll wrap up with some additional information about future Bree events. And then I'll go ahead and ask Beth to add the link for our evaluation survey now. You may consider completing the survey during the webinar or leave it till the end, but please do complete it. We rely on this feedback to determine future topics and select future speakers. And then I'll just go over our learning objectives. You should be able to recognize major health risks from wildfire smoke in pediatric asthma patients, to apply strategies to minimize triggers related to wildfire smoke, to identify resources available for supporting people during wildfire smoke events, and to promote community initiatives aimed at improving health and well-being. I'll now invite Emily Noodleman to talk about the Bree Collaborative.
My name is Emily Noodleman. I use she, her pronouns, and I'm the Transformation and Community Partnership Manager at the Bree Collaborative. As we begin, we just want to provide a brief introduction to the Bree Collaborative. The Bree was developed in 2011 by the Washington State legislation so that public and private healthcare stakeholders would have the opportunity to identify specific ways to improve healthcare quality, outcomes, and affordability in Washington State. These stakeholders are appointed by the governor as collaborative members and represent different sectors of our healthcare ecosystem, such as hospitals, clinicians, health plans, purchasers, among others. At the Bree Collaborative, each year we identify healthcare services with high variation in how care is delivered, poor outcomes, or safety and equity issues. After those topics are identified, we form a work group of subject matter experts to develop a report and collective action guidelines directed at those different audiences in our healthcare ecosystem, again, such as those clinicians or delivery systems, and many others in between. For example, in 2023, the Bree Collaborative developed a report and guidelines on pediatric asthma. And this year, we are currently developing a report and guidelines to prevent and reduce health impacts from extreme heat and wildfire smoke. As part of this year's work group, we are actively discussing how heat and wildfire smoke impact individuals with chronic conditions like asthma and exploring ways the healthcare system can better support them. These reports, again, are directed towards those audiences and with a special focus in Washington State, but we really see anybody anywhere in the United States or elsewhere could utilize these reports. We highlighted one of the reports and put a link to that in the chat if you're interested in looking at them more. In today's webinar, we are pleased to invite experts to discuss the current wildfire smoke situation in Washington State and explore strategies for supporting those affected.
Thanks, Emily. I'll now introduce our speakers. Dr. Mary Crocker received her medical degree from Florida State University College of Medicine and a Master of Public Health from the University of North Carolina at Chapel Hill, where she also completed her residency and fellowship. She's an assistant professor at the University of Washington and pediatric pulmonologist at Seattle Children's. She has expertise in the management of cystic fibrosis, asthma, acute respiratory illness, and is a physician researcher investigating topics related to reducing health disparities in children with respiratory disease. During today's webinar, she'll be sharing lessons learned from the development of an asthma screening tool administered by community health workers. Additional projects that she's involved in relate to the patient and family perspective on virtual health worker visits with asthma and a multinational perspective on the effect of household air pollution on the risk of developing pneumonia. And then we'll hear from Dr. Liz Walker, who is a leader in the field of public health with expertise in community-engaged research, disaster resilience, environmental justice, pollution, and wildfires. She received her PhD in toxicology at the University of Washington in the Department of Environmental and Occupational Health Sciences. She is the principal of Smoke Ready Solutions and an advisor to Clean Air Methow and Okanagan Clean Air. As a toxicologist and specialist in risk assessment and communication, she is committed to both practice and research to better prepare rural populations for health impacts of the climate crisis.
All right, thank you, Cora. And thank you all for being here. And I really appreciate the opportunity to talk today, as this is a topic that's been very close to my heart for the last few years. So I am just going to give a broad overview of the topic of wildfire smoke and pediatric asthma. I just want to start with talking a little bit about what wildfire smoke is and what the components of it are, and then I'll move into how that affects health, who are the vulnerable populations, and then what can be done about wildfire smoke, specifically for kids with asthma. And so a lot of my recent work has been focusing on how we can develop actionable strategies to help kids now. And I do want to say up front that wildfire smoke is an issue related to climate change that requires some intense policy action to really stem the tide of where we're heading with wildfire smoke. But I am very impatient and I am not a climate scientist or a politician. And so as a physician, I'm just trying to figure out what can I do right now. And I'm hoping that some of the lessons that I've learned along the way will be helpful for you all as well. So with that, you can go to the next slide. So what is wildfire smoke? Obviously smoke that comes from wildfires. But more specifically, the smoke is from the combustion of biomass, organic material, but also often man-made materials that happen during wildland fires, especially when those fires cross over into neighborhoods, what we call the wildland urban interface. And the smoke is very complex, and one fire is not the same as the next. And a lot of it depends on what's burning, but there are also influences from smoke, or excuse me, not smoke, but from weather patterns and the distance traveled from the fire that determine what would actually be the composition of the wildfire smoke that you're seeing. And some of the most common components include particulate matter, But there's also quite a bit more. There's polycyclic aromatic hydrocarbons, nitrogen dioxides, carbon monoxide, ozone, all sorts of chemicals that we know from other scenarios that are very harmful to health. Um, and as I alluded to, wildfire smoke can travel. It can even travel hundreds or thousands of miles from the source, which you may remember from last year. We had smoke from the Canadian wildfires, which came down to the Midwest and into the Northeast and the Mid-Atlantic areas. So it's not just people who are right next to the fire that are at risk. And then wildfire smoke season is lengthening. From year after year, on average, we're having more land area burned and more people affected by wildfire smoke per year as a result of changes in the climate. And next, please. So this graph just illustrates that over the last 40 years, basically, we've had a quadrupling in the average area burned in the United States. And this is data from the US EPA. And so this is an acceleration, which is pretty concerning. Next. So of the components of wildfire smoke, we know the most about PM 2.5. And for a long time, it's been considered to be the primary pollutant in wildfire smoke, although that's changing as we start to gather more evidence about everything else that wildfire smoke contains. But PM 2.5, it means particulate matter that's less than 2.5 microns in diameter. So it's basically the size of the particles. But that size is really important, which is because that's the size that tends to go deeper down into the lungs and bypass the nose where it could get filtered out, or where larger particles get filtered out. And so in terms of how much PM 2.5 is a problem, for reference, the EPA actually regulates 24-hour PM 2.5 concentrations, which they want to be below 35 micrograms per meter cubed. But when you're around or in close vicinity to a wildfire event, you can see concentrations of over 200 micrograms per meter cubed really easily. And so this is far exceeding what we know to be a healthy level, or exceeding into an unhealthy level. And not all PM 2.5 is created equal either. There is some evidence that shows that PM 2.5 isolated from wildfire smoke may actually be more toxic than that from other ambient sources of air pollution, such as traffic-related pollution. Next. So the way that we often think about the health effects of wildfire smoke and how we communicate that to others is through the air quality index, or the AQI. And this is an index that's actually calculated from data about 6 different pollutants, and PM 2.5 is only one of those. But in wildfire smoke events, the PM 2.5 tends to be the thing that outweighs the others in terms of importance. And so the AQI level is actually determined by whatever the primary pollutant of those 6 is at the time. And this graphic shows what the different levels of the AQI are. And they're color-coded, and they have a number attached to them anywhere from 0 to greater than 300. And then in the center is the PM 2.5 concentration that corresponds to those AQI levels. And you'll see this used a lot in public health messaging, because this is how we communicate about the pollutants in the wildfire smoke and what people should do in response. And so you'll see that on the right-hand side, there are recommendations that are different depending on whether someone is considered a sensitive individual, which I'll get into later what that might be. But at certain lower levels of AQI, not many changes may be necessary to your daily routine to avoid wildfire smoke. But once you get into the higher levels, into the orange, the red, and especially higher than that, there's many precautions that people ought to be taking in order to reduce their risk. Next. So a little bit more about the scope of the issue of wildfire smoke. This just looks at wildfire exposure days, or smoke days across the United States, that sort of categorizes each county into the number of days of smoke exposure per year. And this is based off of satellite data, but it just gives you an impression of which areas are affected the most. Now, this is a tiny bit old because it ends in 2020, but it does show that California is significantly affected, as are we and Oregon and some neighboring states, but also the Midwest, or the central United States is a lot more affected than I originally realized before seeing this picture. So this is not just a Pacific Northwest issue. Next. And then in Washington, again, this is data that goes up to 2020 or 2021. But this just shows the kind of relative exposure across Washington state. And it indicates that some of the highest risk counties in our state for smoke exposure are Okanagan, Chelan, Douglas, Yakima counties, Kittitas, and then Asotin, especially in the southeast corner. Next. This slide just presents that kind of in a little bit of a different way and shows that we may have pretty good air quality for most of the time, but we do tend to have pretty large spikes in PM 2.5 concentrations related to specific wildfires. And so this is from 2022, data from the Department of Ecology, where I just plotted out the PM 2.5 concentrations to see where it was the worst. And in 2022, actually, Snohomish County was particularly affected, but also some other fairly expected areas such as Chelan, Leavenworth, and Wenatchee. Next. So now to start talking about wildfire smoke and health. And for me, I'm an asthma expert and I deal with pediatric respiratory disease, but I think it's important to know that it's not just the lungs that are affected by wildfire smoke. Yes, that is the most important impact, but there are also cardiovascular effects, especially for older adults. For example, heart attacks and strokes, and some neonatal outcomes, including lower birth weight, and increased incidence of preterm birth. And there's also emerging evidence about diabetes outcomes and chronic kidney disease. And actually, I should have added on this slide as well. I think there's some pretty significant mental health effects as well that we're continuing to learn more about with new research. Next. So who is most at risk? I think it's important to know that there are two groups or two ways of thinking about who is at risk. First, there's those who are especially sensitive to the biologic effects of wildfire smoke. Like there's something about their body, their physiology that makes it more likely that a wildfire smoke event will affect them more than their healthy neighbor. So those people include those with pre-existing respiratory or cardiovascular disease and children, pregnant people, and older adults. And but then there's another group that we would consider more vulnerable, and those are the people that are just at higher risk of exposure compared to other people. So those are people who work outside, those are who are unsheltered, experiencing homelessness, and then people who are otherwise socially vulnerable. So maybe they live in poor quality housing that's really leaky. It's hard to improve ventilation or hard to seal up windows and doors. Or maybe they just have barriers to implementing protective measures because of financial constraints or other issues. Next. Okay, and now to what does wildfire smoke do to the respiratory tract? This is an area of intense research that is emerging all the time, but if you're interested in learning more about this, there was a great paper actually published by a former colleague of mine from UNC last year, all about wildfire smoke and asthma and allergy. And this drawing is from that paper. And just to walk you through it, so smoke comes from a variety of biomass sources, which you can see on the upper right. And it's this complex mixture of PM, particulate matter, and gases. But what that does is has both upper and lower respiratory tract impacts. It can increase inflammation in both areas and reduce our body's defenses to viruses. And in the upper respiratory tract, that leads to increased nasal symptoms, sinus symptoms like rhinorrhea, nasal congestion, sometimes aggravation of existing allergies. And then in the lower respiratory tract, it can have a direct impact on lung function. It can increase inflammation and oxidative stress. It impairs your airway's ability to act as a barrier, leading to increased risk of lower respiratory tract infection. And then this all results in increased respiratory symptoms, especially cough, shortness of breath, feeling of dyspnea, and then results in increased asthma symptoms, hospital admissions, and ED visits for respiratory issues. Next. And so in terms of wildfire smoke effects on asthma, there's a lot more to be learned about this, but what we know at this point is that the clearest evidence seems to point to or reinforce the effects of acute exposure on asthma. So you get exposed to wildfire smoke, and then within a few hours or a couple of days, that leads directly to increased asthma symptoms. And this has been studied in population studies, observational studies, looking at the general population, and from a large variety of different studies, it still seems that the relative risk of increased asthma morbidity is pretty consistent, which is probably about a 10% increase in risk of symptoms or ED visits or hospitalizations per 10 microgram per meter cubed increase in wildfire smoke PM 2.5, which is actually pretty significant when you consider like the levels of PM 2.5 that you could encounter with a wildfire. There are also questions about chronic long-term effects though. And this was investigated in a study of Canadian wildfires, or excuse me, Canadian firefighters, where they found an increased risk in Canadian firefighters of new onset asthma after exposure to wildfire smoke, which suggests that exposure to some component from the wildfire smoke can actually increase your risk of developing asthma when you didn't have it before. And we don't yet have data that investigates that in children, but there are some studies currently ongoing to try to figure that out. And we do know that at least in rhesus monkeys, that there can be long-term impacts on lung function as well from chronic exposures. So, and it's likely that that may translate to developing humans as well, but that data doesn't exist yet. And then there's been some work that looks at those individuals who are of lower socioeconomic status and trying to see if these individuals are at increased risk of exposure. And that has borne out that it seems that people of low socioeconomic status and indigenous groups may have increased risk of exposure to wildfire smoke compared to other people, just highlighting another area of environmental injustice. In children specifically, wildfire smoke, we know, does cause worsened asthma symptoms. It causes increased pediatric emergency department visits for asthma and increased hospitalizations for asthma. And some of that data actually comes from our own state and from some research that's been done by the University of Washington. And among children, those who are younger, like under the age of 5, and those that have a higher BMI are at greater risk of exacerbations when exposed to the same amount of wildfire smoke, PM 2.5 specifically. Next. All right, so how can we protect against wildfire smoke? So there are a long list of things that we can recommend for families to help protect their children against wildfire smoke. And these are available online that we can learn more information about them and help families to learn more. But first and foremost of these is to know their air quality. So to be familiar with the air quality index and understand what different levels mean and what actions they need to take. And then doing their best to keep their indoor air clean. And And what this means is trying to keep wildfire smoke out, trying to reduce the amount of other sources of indoor air pollution, and filtration. So indoor air quality can be dramatically improved by using filters, either a HEPA air cleaner or a box fan filter with a HEPA filter on it, or an air conditioning unit or HVAC system that has highly rated MERV filters. That can, like, even if there's seepage of wildfire smoke indoors, these filters can significantly reduce the PM 2.5 and other pollutants in the home. Other things that families can do are to follow the AQI guidelines in terms of limiting times outdoors and limiting physical activity when the PM 2.5 is high. And for asthmatic patients, keeping their medications stocked and ready to go when they have an emergency. And then trying not to create more indoor air pollution from cooking things, from burning candles and incense and that sort of thing. Next. So when I first came across these different recommendations, I was thinking to myself about how I would apply them with my own family. And because I have a 4-year-old, and it all became a little bit overwhelming. And I started to talk to my patients' families about this in our asthma clinic, and heard from them that they didn't really know how to interpret the AQI. They didn't really know when to bring their child inside, or do they need a HEPA air cleaner, and all of those things, and how would they afford a HEPA air cleaner? And so this spawned a study that we did at Seattle Children's, where we actually interviewed parents about any barriers that they had to implementing all these public health recommendations. And also we wanted to know, where did they want to hear about more information? Like, where did they want to learn more about how they could accomplish these things? Next. So we did these interviews of 23 parents, and here are a few themes that have come out of what they were saying. We are currently actually in the process of analyzing this data. So this is really hot off the press, but this is kind of a sneak preview of what they said. But what we found was that in terms of determining their outdoor air quality, they tended to over-rely on sensory cues, like seeing smoke or smelling it in the air, in order to trigger them to start thinking about the air quality. And so they had not, for the most part, been monitoring their air quality on a regular basis, kind of in a preventative way. Next. The interviews also showed that people were very uncertain about how to apply the AQI-based recommendations in real life scenarios. Next. But they went through very complicated decision-making processes when deciding when to enact these strategies. They had to balance their child's respiratory health against the health and well-being of the entire family. For example, keeping their child inside was actually a very complicated thing to do in some scenarios if they had multiple children, or the parent had to work. And so families are dealing with a lot of different priorities other than the wildfire smoke recommendations. And then they also had little awareness of ways to protect from wildfire smoke beyond just staying indoors and using air filters. They also had a wide variability in access to resources, such as the funds to actually pay for a HEPA air cleaner, for example. And there was high interest in receiving additional education on wildfire smoke, especially from their healthcare team. Next. All right. And I'm realizing I'm running a little short on time, actually over time. So I'm going to go a little bit faster through the next few slides. But that study had to do about what barriers that families encountered in implementing wildfire smoke recommendations. But I also wanted to know, like, what about physicians? I knew that personally, I did not receive any training at all about wildfire smoke in pulmonary fellowship, and that was a little bit concerning to me. So last year, I did a survey study of all pediatric pulmonologists and fellows in Washington State. And I asked them basically, like, have you had training on wildfire smoke and how much do you know about it and how confident do you feel? Next. So some of our key results, most impressive results, are that only about a third had ever had any formal instruction on wildfire smoke or how to help families with reducing exposure. About 2/3 knew how to find the current air quality, but only half of those understood how the AQI is actually determined. So there are significant knowledge gaps here. If you're interested in more details on that, this paper has been published in Pediatric Pulmonology last year. But what I did find hopeful was that the vast majority did consider communicating with families about the risks to be important. And they also felt like parents wanted to hear about it and that it was their responsibility as professionals in pulmonary medicine to communicate that information. Next. And so based on this, we made a variety of recommendations of how to close those gaps in pulmonary provider knowledge. And that is from a variety of different directions. One was in improving provider education and also involving pediatric specialists in the development of ongoing continuing professional educational materials, but also continuing to develop tools that providers can use during clinical encounters to communicate and educate their families. And then improving dissemination efforts for existing resources. Like there is so much information out there that you can find online, but maybe we need to do a better job of helping people to find that information and get it into formats that are easy to use in practice. Next. And so this, all of these realizations from both of those studies left me thinking, what can we actually do to take what we've learned and make it into something that can help our families right now? And we were thinking of a way that we could both like simultaneously educate providers, but also help them communicate with families and help empower families to have the knowledge and the resources to protect their child from wildfire smoke. And out of this was born this idea of a wildfire smoke action plan. And there's also a group in British Columbia who's working on a similar project who actually had the original idea, and I've been partnering with them. But the idea with this plan is that if we can create a brief 1 or 2 page document that is tailored or personalized for the family and for their child with asthma, we can help set them up with an understanding of what they need to do to prepare for wildfire smoke season, and then what they can do in the moment when there's a wildfire nearby, or they're at risk of smoke exposure, or just during wildfire season. So basically, this breaks things down into what they need to do and when, and helps them to operationalize all of the guidelines and personalize it to their specific scenario. And so we have started developing this last year, and it actually has evolved quite a bit since this version that you see here, and it's not really ready for widespread use yet, but we are hoping to develop some educational materials that will help to train healthcare providers to be able to deliver this to their families in a variety of different settings. It could be after a health maintenance visit. It could be from a nurse who calls the family to talk about these things, or it could be delivered by a community health worker. And so we're hoping to make it kind of applicable across different settings. And then you can go to the next slide. And so our next steps for the Wildfire Smoke Action Plan is that this fall, we're planning to do interviews with pediatric nurses because we see them as a trusted group that parents have said that they would like to learn more information about wildfire smoke. So we're hoping to interview them. We're planning to interview somewhere between 12 and 15 to try to get their input as stakeholders on whether this would be something feasible for them to help deliver to families of kids with asthma and how we can improve it for that purpose. We're also working with a graphic designer to improve the readability and usability. And then our next step would be pilot testing. So actually putting it into place to try to get some feedback and then revise and go from there. So thank you very much. I really appreciate your attention here. I know there was a lot of comments in the chat that I wasn't able to look at, but maybe we can come back to that.
Thank you. Thanks, Dr. Crocker. And Liz, I'll let you go ahead and start presenting your slides, but we'll have some time in the discussion. So Liz, feel free to take the entire time that we allocated. Don't feel like you're rushed. We'll have plenty of time. And there was a question about behavioral health in the chat, and I believe Liz is actually going to talk a little bit about that in her presentation. So thanks.
Thanks, Cora. I'll touch on it briefly, but maybe we can get to it in discussion too. So thanks so much, Dr. Crocker. That was a fantastic overview. And thank you to the Bree Collaborative for inviting me today. And really, I also want to acknowledge all of you who've taken the time to think a bit more today about wildfires, what wildfire smoke resiliency looks like, and how we can all adapt to what is most certainly going to be a smokier future. And especially thinking about protections for our most vulnerable community members, such as those with asthma. So my hope today is that you walk away with some ideas and inspiration about your critical role in helping your communities and patients become smoke ready. I began working in wildfire smoke in 2014, and at that time, our best public health recommendations were to stay inside and wear a mask. My work is rooted in what could be considered ground zero for wildfire smoke. The rural communities of North Central Washington, where I live, a number of those, that North Central Washington includes a number of those counties that Dr. Crocker highlighted as at greatest risk for wildfire smoke exposure: Okanogan, Chelan, Douglas, Kittitas, Grant. In practice, our advice to stay inside and wear a mask was entirely impractical. Very few people had or still have indoor air filtration capabilities nor air conditioning. We open the windows at night to cool down, and wildfire smoke frequently coincides with extreme heat and often gets worse throughout the night. Back in 2014, no matter how thick the smoke, it seemed like no one wore a mask. Since then, we've both advanced our understanding of the risks of wildfire smoke and become more sophisticated in offering more efficacious exposure reduction information. So I like to start with this slide to acknowledge that sort of arc of the last decade and offer my gratitude to the very large learning community of practitioners I work alongside, as well as to introduce some of the hats that I wear. So I began my work growing a community-based organization that was part of an environmental organization, a nonprofit, whose interest in the project was really around improving air quality. But after several horrific summers of wildfire and smoke, I saw a great need as well as opportunity in building health leadership and public health capacity to address the health impacts of climate change, predominantly smoke and heat. So over the last few years, with investment from the EPA's Environmental Justice Program, the Washington Department of Ecology, the Washington Department of Natural Resources, and Washington DOH's Climate and Health Adaptation Initiative, my energies have been predominantly focused on building that capacity and working with health and social service providers and organizations, local health departments, schools, and other institutions responsible for those most vulnerable to wildfire smoke. Again, Dr. Crocker, thank you so much for your excellent introduction and overview of wildfire smoke and the health risks and interventions in vulnerable populations. But I left one brief slide in here to highlight that risk perception about wildfire smoke still varies greatly, especially in rural areas and fire-adapted ecosystems where there's a high cultural tolerance for smoke, as well as very few public or residential buildings that offer assurance of clean indoor air. Accustomed to a lot of time spent outdoors, many people do want to know, how bad is it? But I would say that lots of others rephrase this as, is it bad? Or honestly dismiss the idea of it presenting a health hazard entirely. I think this question, how bad is it, is best answered by the facts of what we do know. Wildfire smoke can present health consequences for many, and our climate models indicate that fire and smoke will almost certainly increase for the foreseeable future. And there are practical, accessible strategies that we can take to reduce our exposure and minimize these health impacts. So in North Central Washington, our climate models predict that we're likely to see a 2 to 3-fold increase in smoke days by 2050. When some summers in this area have already brought up to 40 consecutive days of unhealthy to hazardous air, this type of forecast is both sobering as well as emphasizes the urgency of adaptation and preparedness. Finally, I just briefly want to use this slide also to note that our messaging about smoke and creating indoor clean air rooms really needs to consider whether people can adequately cool their environment without opening their windows, and always emphasize that heat is the more acute hazard. Our phrase smoke-ready communities was coined probably over a decade ago, and has become a really convenient handle for talking about preparedness, especially in communities that are also developing wildfire readiness as well. However, for practitioners, it can still feel somewhat opaque. I like this definition because it hits the most important concepts, but it's short enough for me to easily rattle off. Our first box here highlights environmental health and the importance of taking proactive steps to protect the airshed wherever possible. The second box helps emphasize education and self-sufficiency and self-agency. And the last one acknowledges that not everyone has equal access and capacity to prepare and respond. So as we think about all the roles we play in our communities, professional and otherwise, we do have a few different levers to pull to improve health outcomes. While sensitivity to wildfire smoke may be frequently an inherent quality, such as age or pre-existing disease, we can decrease vulnerability to wildfire smoke through a multi-pronged approach with strategies to either reduce exposure, such as through behavioral modifications and getting people to decrease their activity levels when it's smoky and cleaning their indoor air, as well as building adaptive capacity, which I think about as some of our communication approaches that teach how to find the air quality index and use it to plan your day, or ensuring that communities have portable air cleaners that are equitably accessible to wildfire smoke vulnerable households. So depending on the time allotted in the audience, I've got up to my top 10 tools for building smoke readiness, curated on the basis of a decade's work in this area in Washington. Today, I'm really just going to briefly touch on the first one and then spend a few minutes talking about how we measure smoke and how low-cost sensors can be extremely useful and impactful in motivating behavioral change. So this isn't a pop quiz for you right now, but I do estimate that I've exposed probably several hundred health and social service practitioners and public health professionals to the body of information that could enable them to ace this quiz. I like to aim high, but I don't think it's too lofty to think that we can collectively teach this core body of knowledge to any community dealing with wildfire smoke. And I really appreciated Dr. Crocker's survey indicating that we probably have a long way to go with a lot of our practitioners. That's certainly been my experience here as well. And at the end, I'll highlight some resources that are available to help teach this body of knowledge. So hopefully you've gotten a quick scan of this, so you can do a little bit of a self-assessment on how much you may yet have to learn in order to become that teacher in your community. All right, so let's focus a little bit though on number 2 here, because accessing the air quality index and sort of understanding how we measure air quality is not a simple matter. All right, so how is PM 2.5 measured? Historically, monitoring air quality is the responsibility of the state and federal agencies, such as the Washington Department of Ecology and the EPA. We refer to the large, expensive, and sophisticated instruments that they utilize as regulatory monitors. In Washington, the Department of Ecology currently maintains more than 60 of these across the state to carry out many of the responsibilities listed here. 60 sounds like a pretty high number, and you can see that map of Washington state where those are located until you start to think about how big the state really is. For instance, because of historical issues with smoke, Okanogan County, where I reside, actually has a disproportionately large number of these regulatory monitors relative to our small population. We have 3. 2 of them are within 10 miles of each other. And what I've noted in living here and looking at them frequently is that they often report air quality in completely different AQI categories. So this coverage of 60 monitors starts to maybe seem not entirely representative of all the populations we want to know their air quality of. So in the last several years, we've had an explosion of low-cost sensors using simple technology, and this created accessibility to hyperlocal air quality in an unprecedented fashion. There are many companies making these sensors, Purple Air being the most popular and well-known. The indoor and outdoor Purple Air units cost between $200 and $300, making them fairly accessible. And owners can choose to keep their sensor readings private or publicly visible. So now, instead of 60 monitoring stations across Washington state, I'm going to take just a moment here and try to pull up a website for us, which I had thought we had preloaded. Apologies, guys. Okay, we're going to pop it up this way. Just take a little drum roll here. So I'm going to the Purple Air website here. And I'll go from our homepage so that you can see where to access the map. And it'll use geolocating to find me. But what I want you to do is to compare that memory of what 60 air monitors, regulatory monitors in Washington state looks like in comparison to what will take a moment to load here, but several hundred to probably thousands of these low-cost sensors. So with support from the Community Foundation in North Central Washington and EPA's Environmental Justice Small Grants Program, as well as a phenomenal summer intern from the University of Washington, in 2018, I'm zooming in here to the Methow Valley in Okanogan County. We established out here through Clean Air Methow a community-based air monitoring network in Okanogan County. And so we now have 40 indoor and outdoor sensors placed with our clean air ambassadors. These include schools, daycares, farms, businesses, and healthcare clinics. I want to share with you that in my work over the last decade, I have found no greater tool than low-cost sensors for making air quality immediate, relevant, relatable, and actionable. So if we go back to the slide deck, though, what I do want to note is that a $300 tool does have some important caveats that we need to discuss. This is that while these sensors are highly reliable and precise, they do overestimate concentrations of PM 2.5. However, they do it in a consistent and predictable fashion, meaning we can correct for it. I imagine that many of you on this call have probably heard of or utilized Purple Air to look at air quality information. What I find over and over is that a highly underappreciated fact is that if you fail to apply this conversion factor over here, you will likely be seeing numbers that, especially when the air is smoky, are overestimating air quality. So I'm going to go back to our website here and show you where you can find this. So if you're on purpleair.com, this white rectangular box in the upper left-hand corner shows you that you are looking at US EPA PM 2.5 AQI. Those are the numbers we're reading. But this second box here, apply conversion, you have to add this US EPA. And once you've done it once, your computer or phone should remember, but it's worth double checking. I also want to just note another feature here that I think is underappreciated is that we can think about air quality in a number of different time series averaging. In Purple Air as well as airnow.gov, I'm going to go to in just a moment. You can look at both real-time air quality and then different averaging time series. So you could also look at 1 hour average, or you can look at something like a 1-day average as well. And so you can see these numbers changing here. I started with purpleair.com because, again, I have found so much value in these low-cost sensors. But what I really want to emphasize and hope that you will do is utilize and adopt what I consider best practices for accessing air quality data by using airnow.gov fire and smoke map, which you can also use and easily access on your phone with this AirNow app, as well as the Washington Smoke blog. If you are a resident of Washington State, this is another phenomenal resource. And the map and displaying air quality that's found here mirrors this airnow.gov website. So they're one and the same. I'm going to actually give you and encourage you to pick up your phones right now while I continue to talk and download this airnow.gov app, because I really, really want to encourage you to explore that. It's a great tool for understanding air quality. So go ahead. Okay. And so if we start to look at this, this is why I want to encourage this as our best practice. On the airnow.gov website, on the fire and smoke map, what you get is sort of the best of both worlds. You will see data from the regulatory monitors, as well as those from low-cost sensors, the purple air sensors. Regulatory monitors are shown as circles, and the purple air sensors show up as squares. There are also temporary monitors that show up as triangles. That conversion factor that I mentioned you have to apply to the low-cost sensors is already wrapped into the background of this website, so there are no extra steps that you need to take. And again, I'm going to take just a moment here, and we're going to go over to the actual website. And I would encourage you to explore this if you wish on your own computer right now. So from the homepage of airnow.gov, there's a ton of information on this website, and this is an EPA website. The most valuable place to go during wildfire season is to the fire and smoke map, which is located here. Again, this is likely going to use geolocation to zoom into my location, and it may do the same for you. And so besides the fact that the conversion factor is already applied and wrapped into the background here, we are taking some time to load. Apologies.
Just Liz, just as a time check, we have about 5 minutes left.
Okay, great. All right. Well, in that case, let's go back over here. I'm going to encourage you to do this on your own time, but just briefly, two things that I love about the fire and smoke map. It includes a flame icon showing wildfires that when you click on that, you can go directly to NCWeb and get the information about the activity of that fire itself. Another phenomenal resource, I think right up there with low-cost sensors, is the development of the Air Resource Advisor Program. Air Resource Advisors are trained smoke meteorologists who are assigned, they can be requested on wildfires, and they can integrate into the incident command team with the role specifically of producing a smoke outlook and communicating to the public about what kinds of smoke impacts they might anticipate for communities. From that fire and smoke map, you should see that right away, either by this rectangular box with the exclamation point. You can click on that, and you can go directly to the smoke outlook, which gives a description and a 3-day forecast about what the smoke impacts from a wildfire may actually be. Okay, so I mentioned that there can be a lot of confusion out in the public often, and perhaps even among us as a group today, about why numbers for air quality look different depending on where you're looking. So here's a few reasons. That conversion factor or a different algorithm may be being applied to that raw data. There may be a different time series averaging that's being displayed, be it real time or be it a 24-hour average. And then also we have different measurement technologies, which can lead to different accuracies in what the PM 2.5 concentrations or AQI are actually being reported. All right, so I want to say just a moment about low-cost sensors and their applications. So these are not just for outdoor use. We also, Purple Air, as well as others, make portable sensors, handheld, that can be utilized for looking at indoor air quality. I'm going to show you what I hope will be some impactful examples about places that are or are not cleaning indoor air and what the difference is. So most of these measurements were taken when the outdoor air quality was between about 150 or 250 AQI. So first we have a gym or exercise facility here that had taken a lot of steps to make sure they were filtering their indoor air. Again, you'll recall that anything under 50 is considered healthy indoor air, so they're doing a great job. This is taken inside a sick room at an elementary school, and you can see that this is reading 150, which is our where we transition into unhealthy for everyone. This is especially disturbing because this measurement is taken directly next to a HEPA portable air cleaner, which is on and running. So this identified a real problem spot within this building that the building engineers immediately had to start investigating. Similarly, this was a very discouraging reading taken within a brand new library that was built as a cleaner air shelter for people to gather during wildfire smoke episodes. Just after they had opened, it became very clear that some additional adjustments were going to be needed to be made with regards to how that building was functioning when they were taking, I took this reading of nearly 200 inside this brand new building. You can almost see this. I believe that's reading 76. So again, this is a gym where students are being brought inside to have indoor recess instead of being outdoors when there's wildfire smoke. It's an improvement certainly upon outdoor air quality, maybe not all the way down to where we want it to be, but a significantly cleaner airspace for kids to spend time exercising in. And finally, this was taken inside a grocery store. Many buildings that are not employing building engineering for air filtration and that have a lot of people coming and going, unless they have some sort of positive pressure system in place, are not going to be able to preserve their indoor air quality. In the interest of time, I'm going to skip through this, but this is a lovely success story about a school that had made some investments in their gym and was able to host an indoor basketball tournament when the air quality outside was pretty poor. So just in summary then, these are some thoughts for all of you to think about. As I said, perhaps with your organizations, these low-cost sensors can be extraordinarily valuable tools for looking and verifying whether or not the spaces that you are especially concerned about, typically those where vulnerable populations are spending their time, are actually achieving clean indoor air. And once you've made changes, either supplementing with portable air cleaners or otherwise, whether those steps have actually been successful. And finally, you know, we can think about designing indoor air cleaner distribution programs and thinking about who are most in need of receiving those. We know that shelters, whether for heat or clean indoor air, are often underutilized or not necessarily very accessible to many in our population. And so also making sure that people can be safe in their residences and homes is really, really important. Okay, so just to wrap up, I'm going to leave you with some resources as well as the ability to go and learn more now that you're so excited to really dive into wildfire smoke. This is our #1 piece of outreach material. It's a rack card with a smoke-ready checklist with 5 simple ways that people can prepare for and respond to wildfire smoke. This is entirely customizable with your own logo and website, as well as this phrase up here, which is specific to Okanagan County. This is available on smokeready.org, or you can certainly call me and ask to utilize this. I also want to highlight, and I saw that some of our colleagues are here today, the Washington Department of Health is recognized nationally and internationally for their leadership in wildfire smoke and the development of materials and resources. These links should work, I hope, as you receive these slides after the webinar today. One really great one that is both relevant for you as well as possibly to your patients and families, as well as the Children's Activity Guide. We love feedback. The group that is responsible for authoring and updating this is very receptive to receiving feedback about what does and does not work for you in using this as a teaching guide for anyone responsible for caring for children. So this year, there are a number of appendices that have been included as well that include some really excellent practical ways to think about indoor air quality monitoring and improving indoor air quality, as it is our #1 recommendation for interventions.
Hey Liz, for time we have to keep going, but we really appreciate your presentation. And just so you know, everyone, we will be sending out a PDF copy of these slides to everyone, so you will have access to these wonderful links and resources that Liz has on her slides. But we will transition it over to Cora and invite Dr. Crocker to also come on, and we will transition to our discussion.
That's
So Cora, I'll
great.
let you ask the first question to our group.
Sure. Yeah, thanks. And I'll just pull it from the chat. But I'll also invite others from the audience. If you do have a question that you want to ask one of the speakers, use the emoji and raise your hand and we'll call on you. But I wanted to ask Dr. Crocker, I want to give you the opportunity to expand on the behavioral health impacts of wildfire smoke. Did you want to touch on
Yeah,
that?
thank you. You know what? I wish that I had more expertise in this area. So unfortunately, other than knowing that there have been some mental health effects that have been described in terms of anxiety and depression, um, beyond that, I don't have very many details to give you. But I'm sure I could do a little bit of searching and point you to some resources. But yeah, since I'm more of a pulmonary specialist, it's kind of not something I'm able to expand on much more.
Yeah, no problem. And then Liz, if you had a quick comment, just
Yeah,
on-
so we actually had an MPH student do an excellent project out here, her practicum that's published as Humphreys et al. And I believe it's 2021, but I can pull up the citation for everyone in just a moment. So we did some focus groups, and that project was really spurred after talking to a number of clinicians who noted that during wildfire smoke episodes, regardless of whatever the presenting complaint was from patients, so many people were talking about the impacts on their mental health and well-being, exacerbations of pre-existing mental health conditions, but just generally also recognizing that almost everyone is experiencing insomnia, hypervigilance, stress, anxiety, all kinds of trouble focusing, concentration, etc. So the literature is not probably where we would like it to be yet, but certainly from a public health perspective, recognizing and normalizing and giving people simple strategies for coping with the mental health impacts is really important. And a lot of that often is due to simple disruption in daily routines.
For sure. Thank you both. It's so relevant, right? And both of you guys, spoke to it. So thanks for recognizing that. And then Dr. Crocker, a question came in. Does Seattle Children's provide air filtration tools to patients?
Yeah, at this point, we don't. And it's something that I think that we need to advocate for. So right now we're just sort of at the stage where we're all trying to increase our awareness and kind of disseminate the fact that this is a problem that's affecting our patients. And I think once we can accomplish that and kind of bring it to awareness of different healthcare systems, that's something that we could definitely advocate for.
Yeah.
I'm also wondering about the opportunities for that at more of a statewide level, if there's any way for the Department of Health to subsidize things like that, or at the county level. I'm sure.
I love it. And this is the space, to make those recommendations and comments. So thank you for saying that, Dr. Crocker. And then Denise had a question, Liz, and that is, do these low-cost indoor air sensors measure VOC?
Some of them do, yes. I mean, there are a number of different products on the market. My focus has been predominantly on PM 2.5, and what I have heard for some of them is that the sensors that are most accurate for PM 2.5 can sometimes be inaccurate around VOCs. So there's some good resources with regards to where those have been sort of analytically validated and investigated. The South Coast Air Quality, again, Annie looks like she's on the spot for putting things into the chat. But if you could help me out with that, Annie, and the information available through SC, I'm going to get the acronym wrong, but thank you. We can put that up there.
Thanks, Annie. And then you may have answered this already, I wasn't sure, but Carrie Mueller had asked, what indoor air sensor do you use for the air checks? And then also I was curious, of the ones that you mentioned, was there a resource where folks could purchase them on their own? And then kind of just like segue to that same thought, you mentioned that these monitors are somewhat inexpensive, but $200–300 could still be, too much for some households. So there's not a lot of time. You've done great things in the community, but maybe you could just touch on are there certain things that communities have done to sort of survey real-time air quality? For example, like a school or a YMCA purchasing one of these for their organization and sort of having that be the communication hub for people. I'm always thinking about, whether it's elderly or people that don't have the resources to have an iPhone or access to the internet. How can those people, get this real-time information in other ways?
Thanks, Cora. I think you kind of asked two pieces there, but I will take the opportunity to encourage, all of your organizations. We've had healthcare clinics create sort of prominent displays in patient waiting rooms where they're showing real-time indoor air quality, as well as perhaps demonstrating a box fan filter and have some other information available there. Schools can certainly do the same, both with outdoor and indoor monitors, and utilize those for decision-making to protect children's health. Really, again, any organization that is responsible for serving and protecting a vulnerable population can think about, and I'd love for you to think about how to utilize those tools. In terms of, for those that don't have access to the internet or otherwise, it's a really tricky one. Actually, we started with a very low-tech solution where we had magnet boards out in the community displayed, where we would put out, sort of a color-coded good, yellow moderate, USG and healthy for sensitive groups. But that becomes very labor intensive to keep those up to date because you need, often wildfire smoke is shifting quite frequently. And so what we found was that if, someone had come out in the morning and the air quality was good, but they'd forgotten to go back in the afternoon and change it, and now it's really smoky outside, that board all of a sudden loses a lot of credibility with regards to, wait, is that really reflecting what the air quality is? So that's tricky. I know EPA also has a flag program that they similarly offer to schools and other places where you can raise a color-coded flag corresponding to the air quality. Same thing. We just need to make sure that you have the manpower or person power to update that when you have significant shifts in air quality.
Sure. That's great. I'm just going to read this comment in the chat, and then Dr. Crocker, I'm going to sort of preface it sort of with some thinking that I was having too from the clinician perspective. And I know that most of your population, are pediatric patients, but for many of us that manage patients in primary care and things like that, I understand that there's probably some compounded risk,
No.
I'm sorry, that wildfire smoke can have, with patients. And so I'm thinking about like historical risk, like if, they lived in communities that were mostly dependent on like wood stoves and things like that, and then sort of adding the impact of wildfire smoke then to the risk. Sort of how do we sort of screen better patients that have that compounded risk, that live in these geographies that are, have more prominent episodes of wildfire smoke? But the question similar that is being posed here is, it says the smoke is very impactful for those experiencing homelessness, who many of us care for. And so as we know, they suffer from many pulmonary disorders, from life situations. And that's what I'm talking about. So the compounded history as well. We need to be more flexible and swift in setting up smoke shelters and distributing N95 masks as well. So Dr. Crocker, do you have any comments, and both for you and Liz, any comments sort of on that sentiment?
Yeah, thank you. That's such an excellent question. And I'm sorry earlier for, for interrupting you. My husband came in and asked me a question. So, but yeah, I think that's a very important issue. And I think, gosh, it's one that we're trying to get at through this idea of this action plan, because I think that our advice on this really has to be tailored to individual circumstance. And we need to understand their social determinants of health before we can make recommendations to them, because, strategies to help reduce exposure, they depend on the circumstances, like where that person's living, do they have shelter, what kind of other impacts on their health that they're facing. So we're trying to address that in our action plan by making it an interactive conversation, not just education, but the provider talking with the family about what their barriers are and then tailoring the recommendations around those barriers. Because if you don't have an HVAC system, it's pointless to recommend, change your HVAC filter. Or if you live in a home that has a lot of infiltration from the outdoors, you're going to need to really address those things in addition to filtration. And in terms of the issue of those who are homeless or don't have shelter, I mean, that is just, I feel like, one of the most difficult and challenging scenarios, because that is just constant exposure all the time. And I think what the participant had mentioned was, thinking about clean air shelters and N95 mask distribution. And I think those are two probably of the most highest priority things that could help that population. And I think that's a responsibility of our city, our counties, our state, to help enable that, to put resources into that, to make those a priority, because clean air shelters are ways that unhoused people can find clean air and could potentially dramatically reduce their exposures. And N95 masks as well are a way that you can reduce your exposure without having to go inside. So, but yeah, very challenging situation.
Great, thanks.
I hope that answered your question.
Yeah, thank you. And it's complex, right? So thanks for trying. And Liz, do you just have a quick comment? And then
only in recognition of this audience, and that, for those representatives in municipalities otherwise that Dr. Crocker just noted as being the ones most responsible for and having the tools to create shelters and programs and otherwise, they need the data that is often resides within the healthcare system, and to hear from physicians and healthcare systems about the impact that this is having to create the urgency around the necessity to do that.
right.
Cora, I just wanted to note that Dr. Nayak, who we work with, has her hand up. I'd be curious what she wanted to jump in on, if that's okay.
Yeah, actually, I was going to actually close with inviting Dr. Nayak to come off real quick if she had a comment or question.
Yeah, well, first, thank you so much, Dr. Crocker and Dr. Walker, for your excellent presentations. Both of you had noted something that I think is really important, is advocacy. What we have found, I'm in Wenatchee at Confluence Health, and what we have found with our children with asthma during wildfire season is that it is our lower income households who constitute most of our cases of pediatric asthma emergency department visits during wildfire season. And the majority of those patients, after analyzing the data, are the payer is Medicaid. We know that Medicaid does not cover asthma interventions, including air purifiers and air cleaners. So there certainly is an urgency to expand Medicaid coverage for air purifiers and air cleaners for children and anyone with asthma, really. So on this call, I hope to reach out to anyone who might be able to work on that advocacy, and I'd be happy to work with you all on sharing our data that shows a great need for that advocacy to increase Medicaid coverage for asthma interventions. Thanks.
Agreed.
I'm so glad that you mentioned that, because I also think that's a really high priority.
Especially in Washington State.
Agree. Emily, I'll invite you back to the call if you want to close this out. I know you put some things in the chat regarding future events.
Yeah, thank you so much, Cora, and thank you so much to our speakers. We are so grateful for your time with us today. We want to go ahead and close this event. It went by so fast, and so much wonderful information that's been shared. We put some information in the chat referring to a survey. It's always really helpful for our team if you can take a moment to complete that and provide us with this feedback. If you'd like to stay up to date on our report schedule, or that report we're working on, it is scheduled to be published near the end of the year, and we are happy to email that out to you once it is published and up for the public to see. We are really excited to have that and to host some more events similar to this in the next year. We also encourage you to attend our other events. We have quite a few coming up that you are welcome to attend. We'll send this out via email as well. But next week, we're going to have a webinar on the 1115 waiver updates and community hub models within Washington State. The following week, we'll learn about prediabetes care pathways to connect patients with community support, where a clinic developed a care pathway to identify patients with prediabetes and connect them to a diabetes prevention program. We're going to be navigating some conversations on health equity and the sustainability of health equity. We're also going to be doing some work on newborn care too in September that you're welcome to join. But again, we really want to extend our gratitude to our speakers for providing their time, knowledge, and expertise. This has been a great event, and we are so grateful for each of you to join us today. Thank you so much.
Thank you.
Thank you. Thanks, everyone.